My name is Robin. I'm 57. I had the closest thing to an idyllic childhood that anyone can actually have in real life, and lots of support from my family. Anxiety and depression have been with me my entire life, so it doesn't feel so much like it's affecting me as in, this is my life. This is who I am. This is how I am. Depression doesn't run in our family. It gallops. My father had depression. It was not treated, but he managed to mask it when he was with us. Everyone except my mother has been affected personally by depression, and of course it affects her peripherally because all of her family has it. It's taken away my motivation to do anything. I have a very hard time taking care of myself because you have to care about something before you can take care of it.
Robin's condition, her diagnosis is major depressive disorder. It can be difficult for a layperson to understand the difference between clinical depression and everyday depression that we all experience from time to time in our lives. Someone with clinical depression can have everything going right in their life and still feel as if there is this huge 100-ton weight on their shoulders, this cloud covering everything. Robin has been a patient at Hunterdon Health for approximately 4 years, although I know she struggled with depression and anxiety throughout the course of her life.
Hunterdon Behavioral Health has served tens of thousands of consumers since the inception. To address the growing need of crisis services, Hunterdon Health recently expanded the existing emergency room and added 8 new behavioral health beds. Our treatment team provides services at the individual therapy level, group and/or family, as well as a hybrid model, which is where the patient has the option to come in person for a session, or we would use telemedicine and it would be a remote session.
The staff and the facilitators do a wonderful job with supporting us in our journey toward mental health. They actually care. You can tell by the way that they're interacting with us that this isn't just a job to them. They really want us to do well. Group therapy is key for us because it builds a community that is filled with people who have, in their own way, experienced the same illness as everybody else. It is so comforting when you know that you're not alone, and when you see other people making progress, you can tell yourself, oh, I can make progress too.
It's very much a healing community. They're here very many hours a day for many days a week, and they get to know each other and they get to support each other. For some people, that's the first time they've had that level of support in their life. So that's something that's very unique to this setting, and it's a very powerful healing agent.
The typical patient that we might see at Hunterdon Behavioral Health is really no different than you and I. It could be your neighbor, it could be somebody that you're interacting with at the supermarket, or even while you're waiting in your local doctor's office. Mental health certainly does not discriminate against anybody.
When we talk with folks where the life that they want, the life that they had, the person that they know they are inside, very often they feel that that's gone. But it's very important for someone in Robin's position to understand that that person isn't gone, that person is still there. You know, they're not depression. They're someone suffering with depression. And hopefully by getting treatment at places like CBR, that blanket can lift and they can see the life that's there waiting for them.
For people who have come to the conclusion that they need help, the Hunterdon program is the place to go. It gives me structure. It gives me distraction away from my bad thoughts. It gives me community. And when I'm lucky, it gives me insight into how you can improve what you can do to get better. Now, I have reason to leave the apartment. I have reason to take care of myself so I'll be presentable. People who need help, who need treatment, and for some reason, because of stigma, because they don't realize that they're being affected by a mental illness, if they can get referred into this program, they will see the same benefits that we see.